Here is the medicine section, your 2020 CPT. Let's kind of walk through it and then we'll do some practical examples. Starts with your index pages. Then you have some guidance on your green pages. Again, the same guidance for add-on codes and separate procedures that we've been using. Special report. So use of supplied materials, that's going to be your 99070. A lot of times these are bundled in, so be very careful using that code. And then this is telling you that you may need some image guidance from the radiology, or it could be bundled in. So the first part starts with your immunoglobulins. This is administration of them, or this is the substance, this is the product, and then the administration of them will be later on. We'll get to those codes in a minute. I do code here that you need to code the administration of the actual product too, but this is the product. This is your actual immunoglobulins. This next section is your vaccines for kids or adults, administration codes. You need to watch. What's critical to these codes here is 90460 and 90461. These are administration codes if there was counseling done for the vaccines. So if the physician counseled or provider counseled the family or patient, if it's a kid, it would be the parents, if they counseled them on pros and cons, risks, benefits, side effects, that kind of thing, then it falls under these administration codes, and they're based on components. So each individual vaccine is a component. So you may have 3 vaccines in one. And we're gonna, once I walk through this, we're gonna come back and we're gonna do an example of how to code the MMR. Measles, mumps, and rubella, which would technically have 3 components. You've got a measles vaccine, a mumps vaccine, and rubella vaccine, all in one. And I'll show you how to use this. So we'll come back to that. Make sure you're seeing your mode of administration, whether it's intranasal, IM, intramuscular, or sub-Q, which is into the fat. Make sure that you're paying attention to that. These are the administration codes. Starting here is the product. This is the actual substance. Alphabetized, there's several pages of them. All of your childhood vaccines will be in this area. And we'll come back and do a few examples in here, because that'll be good to use. I promise you will have that multiple component administration code on your CPC board. Then we get into psychiatry. Really good guidance here, kind of breaks it down. One of the more common codes in here is your psych eval, which is 90791. But this is your different psychotherapies, whether they're group or individual, based on time. Psychoanalysis, then you get into different procedures that they actually do. Hypnotherapy, electroshock, that kind of stuff is in here. Biofeedback is in here. Then we started dialysis section. The entire medicine section is a catch-all. I've talked about the catch-alls in every section of the part of the CPT. This is an entire section of catch-all. They've just thrown stuff in. So it's, in my opinion, a little bit more difficult to find what you need. So you have to become a little bit more familiar with it. Spend a little time labeling and making notes so that you can more rapidly get to stuff. This is your dialysis section, your ESRD, end-stage renal disease. Of note, whereas our radiation oncology treatments or fractions were billed weekly, these are billed monthly. These will be billed monthly. So you will see a breakdown of age, how many treatments, treatments a month. That's what you'll find in here. I had to underline under miscellaneous dialysis procedures. This is probably talking about peritoneal dialysis. That would be the next most common. It is not hemodialysis. It is with hemodialysis, you're going to have a fistula probably in the forearm that connects, it's an AV fistula, connects the arterial and venous blood supply so that you can have hemodialysis in a 3 or 4 hour time period. Those fistulas are in the cardiovascular section. We talked about them. This is the actual dialysis procedure being done and maybe hooked up to an AV fistula. So hemodialysis is going to use an AV fistula, whereas your peritoneal dialysis would not be. It would be different. Peritoneal dialysis can also be done at home. The patient can do it themselves. Gastroenterology. This is just an absolute catch-all of weird motility testing of the gastro system. Could be esophagus, could be the GI tract, different sensation, rectal sensation codes. Maybe someone cannot use the bathroom. Have bowel movements like they should, and it may be loss of muscle tone or loss of nerves or loss of, so they're checking motility and sensation, tone, maybe of the rectum or the anus. That would be in here. Gastric physiology is, remember, physiology is function, so that would be another example of motility testing. Ophthalmology. This is your eye doctors. This is where they're going to get their codes. You have new patient and established patient. This kind of takes us all the way back to the beginning of the CPT when we did E&M and we thought that nightmare was over, but it's not. Different special ophthalmological services in here, fitting of contact lenses, tomography, maybe doing some CTs of the cornea. That kind of stuff is in here. Scopes of the eye is in here. Specialized services. Maybe they're doing some retinography. It's a hard word to say. That would be taking pictures of the retina. Contact lens services, spectacle services. This includes the aphakia, the prosthesis. Special otorhinolaryngologic. So oto ear, rhino nose, laryngo is the larynx. So this is different speech stuff in here, different nasal stuff, ear stuff, vestibular issues and testing. Audiologic testing, so these are hearing tests. Evaluative and therapeutic services, again, on ears, cochlear implants, that kind of thing is in here. Just a catch-all, man. Now we get into cardiovascular. At least it's kind of divided into body parts, so if you can get there, you will do better. That's all I can say. CPR code is 92950 is our CPR. So we have different balloon procedures on valves in here. Then we get into the coronary, some of the coronary therapeutic surgeries. This is where your stents are going to be, your angiographies of the coronary arteries. Really, really good information in here. What's bundled in, what can be what's bundled in, what you can code separately, really good stuff. So, and we'll do an example of how to stack these, but you can stack your stents. Stents would be, several of these are stents. I have to underline in here again, like code 92924, atherectomy. That's a removal of athero, which is plaque, so that's plaque removal. Your stents are 92928, 92929. And we will do an example of how to stack these, but really pay attention. These are angioplasty stents being placed in a single major coronary artery, and then a different. If they put multiple stents in the same coronary artery, it's one code. You don't code for multiple stents in one artery. What you're doing is coding for multiple stents in multiple arteries. So really make sure you get your mind around that. This is doing a revascularization, maybe of a graft. Maybe we did the cabbage back in the cardiovascular section, and now they've come in a year later, 5 years later, whatever, and they have to revascularize a bypass graft. Maybe put a stent in it, something like that. Code 92941 is specific to during an MI. Really underline and read your stuff or your codes. Here are the stress tests. So code 93,000 is an ECG, electrocardiogram, gets done a whole lot. If it's tracing only 93005, that would probably be to your facility. Maybe a patient went in outpatient to have an EKG or ECG. However, I'm old school, so it's EKG to me. And the hospital did just the tracing only. So they get to code for 93005, but your doc's going to get to code for 93010. If you have the EKG in the doctor's office, then the doc would get to code for the whole thing, 93000. Same kind of thing for your stress tests. So it's divided, so your 93015 is the complete stress test. So if the patient went to the doctor's office, had the stress test done there in the office, then the doctor gets to code for all of it. If the patient went to the facility outpatient and had a stress test, then you have to break the component up. So you have a supervision only, a tracing only, and an interpretation and report only. So the facility would get your 93017, and the doc would get the 16 and the 18. So that's how that's divided up. Implantable wearable cardiac devices, really good information in here. Again, fairly technical. This is programming of your pacemakers and defibrillators. Usually your cardiologists have a pacemaker lab, or pacemaker clinic that they have on certain days, and for 3 or 4 hours on those days, people come in and have their pacemakers calibrated, reprogrammed, that kind of thing. Now we're getting into echoes. So your echoes can be transthoracic or transesophageal. Transthoracic is just through the skin on top of the chest. That's what we normally see. Transesophageal means they've gone down the esophagus and they're looking almost from the back and the side, or the side of the heart. So that's a lot more invasive. I mean, the patient, nobody willingly has a tube put down their throat to look at anything. So there would be some meds involved, Versed or something, some conscious sedation involved. So that's the difference. Cardiac catheterizations. 10 years ago, this section was a stinking nightmare. We would stand in the classroom and have to write it out on the whiteboard, and you might end up with 5 or 6 codes. Now they kind of bundle stuff. So if you read your code descriptions well and follow the indenteds, you may end up for 5 different things, only 1 code. It's really been improved. I would recommend you go through and write, underline, highlight, right and left heart, because that will matter. You have a code stuck down here at the bottom of the page that is very easy to not even see. So I urge you to make note of it, because this is the most common part of the cardiac cath. And then the next page, everything is indented underneath it. It was, in my opinion, very poor planning to have this code just hanging out here with everything else indented underneath it. So if you look, this code description, the semicolon is at the very bottom. So all of these procedures, so the angiography with the injection, with the imaging and supervision, all applies to all of these codes. And so the most common code that you would come up with is 93458. So if your family member or yourself is having chest pain and they want to do a cardiac arteriogram to assess for any blockages, this is the one code that they're going to do. So you're going to take the description from over here, bundle it with left heart catheterization, including the injection and left ventriculography, come up with code 93458, and that's the only code you need for all of that. I have gone in here and written my right and lefts. It just helps my eye. That works for me. You do what works for you. Here is some, and it's sideways, but this is taking a lot of the information and plugging it in for your heart caths. I do use other tables. I do not use this table. It gets confusing to me. But you may very well like this table and want to put all your notes in the table. That is 100% up to you and how you flow. Heart defect repairs that are percutaneous catheter type of procedures. Then we have electrophysiological procedures. These are intrathoracic. So this is looking for electrical activity or recording electrical activity. Bundle of His, that's electrical activity within the heart. Intraventricular pacing. Comprehensive electrophysiologic evaluation with right atrial pacing and recording. So it's very, very, very specific. So if you're reading and know that they're not performing an ablation, this is recording electrical activity. Those ablations that are in cardiovascular are the procedure destroying those areas. This is just recording it, recording the activity. So they probably did this before they do those other ones. We get into non-invasive physiologic studies. This is if we're going to have something, this is probably what we would all prefer because it's not invasive. It's not going to hurt us. Non-invasive vascular. So this is where they're going to look at maybe DVTs, deep vein thrombosis, arterial clots, that kind of thing of the extremities, or these are extracranial artery studies too, looking for blood clots probably. So you have venous extremities and you have arterial extremities. So really that one word makes a heck of a big difference. Pulmonary, this is ventilator management. So if your patient, if you're coding for the doctor who has a patient in the hospital who is on the vent, this would be his management of it. These respiratory, this is what your respiratory therapists do, your spirometry, your breathing treatments, that kind of stuff, that's in here. When we get into the next step book, we'll talk about a few of these codes a little bit more in depth. But for right now, just knowing that they're there is probably good enough. Your allergy and clinical immunology. So this is your allergy testing, and then your allergy shots. These are your shots. Know that provision, the lingo provision in here means the substance. So if you're determined to have a grass allergy and you need a shot every week for your grass allergy, they've made you up a provision or a substance that you're going to have injected into you, whether you give yourself your allergy shots or you go into the clinic. So that's what a provision is. Endocrinology, not much there. We get into our sleep studies. Lots of folks have snoring issues and sleep issues, so I actually see a lot of sleep studies day by day in what I do. I don't code them, but I see them in the chart. There are for sleep studies, there are 4 or more criteria here. When you see the code, this is the criteria they're talking about. So the codes are over here. Your polysomnography. And then they're talking about the parameters of sleep, 4 or more additional parameters of sleep. These are the parameters they're talking about, additional, in order to plug in for that code. EEGs, some of this looking at brain activity, whether you have seizure or epilepsy issues. You have intraoperative, that maybe you're having some type of surgery that your brain waves need to always be monitored intraoperatively, so that would be in here. Electromyography, this is muscle, looking at muscle conduction, your actual nerve conduction tests. This stuff really, and you can see this is just a catch-all. There's almost no rhyme or reason to it. Probably, and this is the only section that I ever say, in my opinion, it's okay to use the index in the back. Or do they call it index? Yeah, index in the back. I was thinking I had the name wrong. You may have to for this area. Evoked potentials. Remember we talked about this area in the back surgeries, infusions. This is just, you just have to kind of weed through here. The 321 textbook does a good job of at least getting you somewhat in here. If you ever needed a diagram of the 12 cranial nerves, in school 100 years ago, we learned it, Old Olympus Towering Tops. On Old Olympus Towering Tops, you may have learned that too, but that's how you learned your 12 cranial nerves. But that's a great diagram that if you know it's there, regardless what you're working on, you can use it as a resource for you. Medical genetic testing and counseling is in here. This is a fairly new area. Very, very specific again. Central nervous system testing, neurocognitive stuff, potentially maybe Alzheimer's is being tested in here. Cognitive level, developmental, maybe there's a child that needs some developmental testing. Health behavior intervention, whether it's family or individual. We're almost done. Then we get into, so that was kind of a catch-all. Now we're getting into our IVs, our IV pushes, our IVs for hydration, and our therapeutic administration. So the very first part of the medicine section had, let me get there, had immunoglobulins. The only time you would get immunoglobulins was to treat something. So they're therapeutic, so your injection would come at therapeutic, whereas your vaccines are prophylactic. They're trying to keep you from getting sick. Your immunoglobulins may be treating a sickness. So that's why the administration codes are here for the vaccines. But in this area is where your therapeutic administrations would be for that very first section of the medicine section for immunoglobulins. So here you have hydration only. This would not be, this is just to keep you hydrated. And it's based on time. Has lots of parentheses. Your next section is your therapeutic section, but it is not chemotherapy or any of those really high power pharmaceuticals. So here you have IV infusions, sequential and concurrent, sub-Q infusions. Here's the administration code for those immunoglobulins, therapeutic, prophylactic or diagnostic injection, substance, or drug. And it tells you here for administrations of vaccines or toxoids, go someplace else. Don't use me here. Then you have your IV pushes over here. Then you have a chemotherapy section. This is administration of the chemotherapies. You have a photodynamic therapy. This is your physical therapy section. And occupational therapy. We all kind of know what that stuff is. We do have some good parameters in here. Modalities, whether they're supervised or not. In this same set, active wound care. See, what's interesting, so we had all of our physical therapy and occupational therapy stuff. In just a minute, we're going to have the osteopathic and the chiropractic physical therapy or modalities for their treatment. I would have put that close to the physical therapy and occupational therapy. They did not. So active wound care, maybe a patient has a diabetic ulcer and they're having to routinely have it dressed. Here's your osteopathic manipulative treatment, followed by your chiropractic. So you would see those OMT and CMT. Some patient education. Then we have non-face-to-face, maybe a telephone assessment and management. Miscellaneous section, which is just a bunch of stuff. Hospital mandated on-call service in the hospital, just kind of junk. We have our anesthesia modifiers that we already have in the front of our anesthesia. Here's our MAC, or a moderate conscious sedation. I would very much use this table and just plug it in. It's based on time and age. We have home health services. These would be used to some extent for your home health, but they're not all the codes. They have another system. Okay, so that is your medicine. So let's go back and I held my hand funny. Let's go back and do an example of using, remember I said we're going to come back and an example of using the administration. So we're going to code for an MMR. That's measles, mumps, and rubella. That's what the kid or adult is coming in for. These are 3 separate components in one vaccine. The provider does provide counseling, go over the risks, the benefits, the side effects, all of that with these. So your 90460 is your, say your patient is 16 years old, is your immunization through 18 years of age with counseling, first or only component. So if it's the first component, then we're going to say it goes to that first component of the vaccine because we have 3 components. So then we use our add-on code, 90461. That's for each additional vaccine or toxoid. So we have 2 left. So we're going to do a times 2. So in all, we have 1, 2, 3, and we have 1, 2, 3. Okay, let's do another one. Let's do a what would be the easiest? Let's do a D-tap. Okay, so this is diphtheria, tetanus, and pertussis. So again, this is going to be, let's say this is on a 9-year-old. So we have 1, 2, 3 components. The provider does counsel regarding the side effects, the risks, the benefits, all of that. So our first component is our first code, 90460. And then our second 2 components, 1, 2, 1, 2. So we have 1, 2, 3. You can have as many as 5. You could have 1 times 4 over here and have 5 components. Maybe it's a big combo med. So that's how that is used. Oh, and then you would, sorry about that. Let's go back to the MMR. So this is our administration, but we have to code for the substance. Shame on me for not doing this. I didn't close that loop very good. So over here, 90707 is our measles, mumps, and rubella. So you would code your administration and your substance. So let's find our DTaP. It's on the same page. So our DTaP was 90700. So you would code your administration plus your actual vaccine. Okay, let's find the administration of an oral medication, oral immunization administration. So we know that, immunization, vaccine, we know we're in here, but it has to be oral. So if we look here, here's our intranasal or oral, so 90473. Let's do one more in here. Patient received a Rocephin IV push through an existing IV. So an IV push through an existing IV. So we've got to go back here. Remember, that's therapeutic. Rocephin is an antibiotic, so that's a therapeutic. So let's go back here and we have to find where that hydration section is. Used to, and I looked last night when I was kind of looking through here, used to have a tab pre-printed for this area, but it doesn't. But if you have extra tabs, you can always tab this area that we're getting to. So it's going to be down underneath our therapeutic and hydration. And it's going to be an IV push. So we had our IV piggybacks. We had administration code for those immunoglobulins or a therapeutic shot. So here's our IV pushes. So it's an IV push, a single drug, because it's just Rocephin. So it's 96374. Okay? So if you that is the end of our CPT. I do have a few sections back here tabbed, but I had talked about them in the first video, just kind of walking through. I very much recommend, if you're doing self-study for your CPC, to get the 321 coded book. That's what I've used as a guide. This whole, these whole, 15 videos or whatever. The next video, we're going to move into the HCPCS, and then we're going to move on to diagnosis coding. Then in our next level, or next step book, next level's church. Next step book, we're going to bring it all together, bring all the manuals together, and it will be very focused on reading a scenario, pulling the information out of it, and then trying to find the right codes for the scenario. So see you in HCPCS world.